everyone. Today we are here with Dr. Visalam for a Thank you, Dr. Visalam, for joining us for a new episode of Fantastic Hour talking about integrative medicine. Now, as you all know, Dr. Visalam is an MBBS doctor who has finished her MD in physiology and a functional and integrative medicine practitioner. And she's got a lot of other things under her belt, which you will come to know shortly. Now, integrative medicine is something which is catering to a lot of chronic ailments, which goes to the root cause of all problems and then tries to give solutions to the patients. So, we are here to ask Dr. Visalam regarding her take on things regarding integrative medicine. We talked about toxins, we talked about nutrients. So, how are we to say if a patient comes in and we want to find out what he is loaded with, what toxins he has got? How do you actually test for these toxins? And once we do test, and how do we then eliminate this from their system?
Doctor, my assumption or my belief is today all of us have all the toxins. So that's the belief you start with. But there are multiple other tests you can test for the specific toxins of heavy metals. Microplastics, we still don't have the tests. Biofilms, we still don't have the test. Auto intoxicants, you can do an ultrasound to see if you have sedimented sludge in your colon. But otherwise, it still does not say that you still have toxins in it. But the other form of medicine, other form of toxins that you can test is heavy metals. You can test it via your blood. You can test it through hair mineral analysis. You can test it through urine challenge test, which is the gold standard today. A non-interventional way is called oligoscan today. Okay. You can test these toxins, you can test these metals, and these metals have impact on your mineral homeostasis. So then you will know which mineral is high, which toxins is high, and how to calibrate them or how to neutralize them. That, according to toxins, you can do. But how do we eliminate it? Is I eliminate them with two different methodologies. One is therapy, the other one is nutrition. We will give them high dose glutathione, high dose along with zinc. We can give vitamin C and all these nutrition, oral and IV. If you give them the body, we are helping the body to eliminate the toxins, irrespective of what toxins that they have. Then the second way is the therapies. The therapies in terms of the usual naturopathy therapies that people do, from dry brushing, increase your lymphatic drainage, mud therapies, colon hydrotherapy, far infrared sauna. Today, far infrared sauna is one of the non-interventional therapies to bring out both your heavy metals as well as your microplastics. And then the other form of elimination, the highest form of elimination available today is chelation. You also have something called probiotic detoxification, where you give certain strains of probiotics that can also eliminate these metals. There is something called coffee enema. Go back to your Ayurveda. The Panchakarma that they did is all detoxify you. Yes. Detoxify you of all the colon intoxicants, detoxify you of all the metals that you have. So today you have supplements which can bind. So all these toxins, in terms of heavy metals or everything, they get accumulated in your tissue level, at your tissue level. Now you need something to bring them back to your blood. So you have binders. Then you bring them back to your blood. From the blood, they again go to your liver, get detoxified, and enter your intestine. And then you flush it out through your intestine. When they are in your blood, you can also eliminate them through your skin, lungs, and kidneys. So I detoxify them with, first of all, I forgot to tell you, is you have to reduce the toxic load. Toxic load today comes from our living by itself. Skin care, hair care, deodorants, detergents, floor cleaners, vegetables, pesticides, fruits, inhalers, water. Everywhere there's toxins. In fact, if you open up Google and ask them the number of toxins I'm exposed today on a daily basis, it says 700,000. 700,000? 700,000 on a daily basis. Let's say Google is wrong. Give it 50%. 350,000 in America. Say India slightly little better or even more worse. I will still take it anywhere between 500,000 is the number of toxins that we're exposed on a daily basis. And are we thinking our body is capable of it? Yes, body is a beautiful healing machine. Put in anything, it will send it out if it's not required. But with your lifestyle today,
Hmm.
your body is not unable. Your body is unable to do anything.
And the
So they all get stored.
and the lifestyle meaning not enough exposure to the sun,
Correct.
not doing enough exercise, not doing pranayama, not opening bowels once a day, and having a lot more eating the wrong kinds of food, not sleeping at the wrong time, using more gadgets, and having gadgets in your bedroom when you're sleeping.
Radiation is one of the biggest toxins today.
Hmm.
The unknown devil, the unseen Satan.
Yes. And that EMF, the radiation, I think there are studies which are coming out now which are telling us to limit the use, at least in limit the use in adults, and also to increase the age of the children to at least 12 years before you actually give them the gadgets, because I think they're having a lot of detrimental effects on the brain development in younger children.
The direct effect of these gadgets are which they can be avoided and they can be reduced, doctor. But we're even talking about the EMF, right? We're even talking about the radiation. Children are exposed to it when they're inside the mother.
Hmm.
How do we reduce that? So that's the world we live in, and our body should find a way to fight it. In fact, I went to a conference and they said there are no child who are born who are conceived with a disability.
Hmm.
You know, if they're conceived wrong, you know, that one cell becomes two, two becomes four. If they're conceived wrong, body has a way to eliminate it then and there. But they were conceived normally. But then after the radiation exposure or after the stress of the mother or the infection of the mother is when the DNA is changed, and that could be the major reason why children are born with some amount of disability. And today autism is the biggest disability that we see. In 10 months of time, I don't know what the mother will do without her phone.
Previously, they used to say that pregnant mothers should not smoke, should have limited alcohol, and now I think in the future that way should include limit the use of mobile phones and don't use smartphones and so on and so forth. So, thank you, doctor. Thank you once again for your time. Thank you.